the gentleman, Dr. Bassam. So we got lots and lots of people. I'll do this standing up because otherwise I'll fall asleep. Lunch was good. So we had a good lunch. Okay. The medical sector in general is one of those areas that is ripe for transformation and completely, exponentially being changed. And AI is playing an extremely important role. Recently, I was speaking at a pharma conference, and we were looking at the future of pharma beyond just a subset of the whole medical sector. And there were 4 or 5 very, very big sort of trends, mega trends that were there. One of them was personalizing healthcare down to an individual of one. Every time is just one. So this whole segmentation is again going down to one. And one of the recommendations, and I will ask this question to the board at some point in time, was to actually have all of you sitting on their boards, not just boring doctors sitting on the boards, telling each other what they should or shouldn't be doing. It's actually we would be empowered and we would go there. Big mega trend that we become stakeholders within organizations, within hospitals and groups, not just focus groups, that actually have teeth. So that was one big trend. The second big trend was obviously artificial intelligence, how that can engage with people and can change their lives. Third one was AR and VR, augmented and virtual reality, because you can actually go inside the whole space, do your whole thing, see yourself within a AR, VR environment. The fourth one, which the medical sector is almost not at all ready for, is 3D printing. In other words, medicine on demand, pharma on demand. Basically, everybody can just print their own medicine. And that would need a new sort of thinking. So for them, rather than give us more pills, they need to be in the 3D printing business. You see the shift that's going on. And I'm throwing these balls in the air just to build context while we're waiting for our guests. I'm good at these fillers that I keep getting. Is Dr. Bassam coming? Yeah. He's coming? Okay. You see, nobody knew it was a filler, right? You thought I was just doing my thing. No. So that's another big trend. So these are some of the big trends that are happening. In terms of robotics and machine learning, you saw some of the slides that I had earlier, the contact lenses that were there that can actually start measuring and doing a lot of diagnostics work. You can have, Dr. Bassam, yalla. You can have your tattoos and you can work with those. So technology is now fundamentally changing the way we run healthcare. And our panel that has been reformed and redesigned, a new panel of 4 people instead of 3, and 2 new guests. So without further ado, I've done my blah blah. Let me just get our team to introduce themselves. Okay. Could you just, in about a minute or so, tell us who you are? I know you're a fun lawyer, and the law is like yesterday, as you heard from me earlier on this morning. No, I'm just teasing you, you know what I mean. But what do you do in terms of a lot of the work that you might be doing, which is pre-legal, and how this thing goes forward? Ma'am.
All right. Hi, everybody. My name's Kokila. I'm the founder of Karm Legal Consultants, not KARM. So what we do at Karm is, Karm by the name means good action. What we wanted to do when I set up Karm was to support tech startup companies and provide them with bespoke legal solutions. So looking at the newer areas of law, of regulations, policies, which the entire tech industry needs. So not targeting the companies who could already have in-house legal support, but to just focus on the new tech companies which are coming with great solutions, with AI for healthcare, with blockchain solutions, in insurance tech, in logistics, in provenance and tracking. So we're in a very fun and learning environment where we're learning every day with the new regulations coming out. We're getting an opportunity to talk to the regulators, to be in open discussions, and talk about this is the industry which is upcoming and is the need of every government, every country, and what do we do to support this industry. That's what we're doing at CARM.
Brilliant. Thank you very much. Dr. Osama, sir.
Okay, so my name is Osama Al-Hassan.
Yeah.
I work for Dubai Health Authority for the last 7 years. Before that, I was with Dubai Healthcare City. My background is software engineering, software architecture. However, I've been with eHealth for the last 10 years. I joined a newly formed department in DHA because we had a restructure just maybe 5 or 6 months ago. And we developed a new department called Health Informatics and Smart Health. And the mandate of this department is to develop a regulatory framework for digital healthcare solutions, starting from electronic medical records down to mobile apps, IoT devices that will be part of patient journey or whatever.
Yeah.
So we are trying to fill in a gap in the market today because we want to regulate but not over-regulate what's happening today. Talking about AI, talking about connected care solutions. So this is our space of interest.
Okay. Can we have a little bit of musical chairs, please? You like musical chairs? We'll have musical chairs. Dr. Kokila, please, if you could come here. Could you please go there? You're okay here, Jonathan, if you can go there. Dr. Osama, if you can please come here. Because otherwise everybody there is getting confused because nobody looks like anything there. And I'm sorry you are stuck under me, so I'll have to wear a kandura to cover my head, otherwise you won't have any hair. Anyway, so thank you, Dr. Osama. I know Dr. Osama for many, many years, and he's doing some amazing work, and I think part of the digital identity environment also that we're looking at as medical, as you know, just as subjects for that is actually quite critical, and there's a lot of good work being done at MOH. Jonathan.
Hi, everybody. My name is Jonathan Konevsky. I'm a plastic and reconstructive surgeon by training. My interest in artificial intelligence is through my company called Imagia. At Imagia, we're focused on building AI healthcare solutions for industry, hospitals, and universities. Specifically, we focus on the imaging side of healthcare. We've built multiple different unique solutions for pharmaceutical and medical device companies in helping them either find the right treatment for a patient at the right time based on medical imaging, for example, such as a virtual biopsy. Today, it's very difficult to do repeat biopsies for patients, for example, in lung cancer. So one of the applications of our technology is to identify the genetics of a tumor based on an image, which can then guide the patient and change the journey of the patient care. We also partner with hospitals, clinics, and universities to help them organize their data so AI can be used in a way that will provide new insights so it can be searchable, and then commercialize those opportunities so everybody involved can benefit. As you've heard before, one of the major problems in AI in healthcare is that data is siloed. What that means is there's pockets of interesting data, but they're just locked away in individual universities, individual clinics. So by federating or democratizing that data, which is our approach, we create a system where everybody benefits from the AI and the tools that we build.
Thank you. Thank you, Jonathan. Dr. Bassam, sir.
Hi, my name is Bassam Mahboob. I'm a respiratory physician by practice. And I used to lead the DHA, the Dubai Health Authority Innovation Team for the last 2 years.
Thank you. So, in my usual way, I'm going to start with something very, very controversial, with your permission. Am I allowed to be controversial? Okay. A doctor friend of mine, a very senior doctor, he said that when he went to university, he heard a story from his professor from Vienna. And the story was that the tap is open and the floor is a puddle of water, just lots and lots of water. And the average doctor is doing this, is cleaning it up. You are cleaning up this. This is all you guys do. So here's the medicine, here's this bit and this. You're just cleaning up the whole thing. what Dr. Simpson was saying to me was, forget all of that, turn the tap off. Proactive medicine versus reactive medicine. Everything I'm hearing, not here, but generally I hear around us, is reactive medicine. How can we fix this? How can we stop that? How can we sort this thing out? And it's all curative. What do we need to do to turn the tap off? Kokila, you are looking at startups. What are you doing to turn the tap off, so at the preventive level rather than the curative level?
I think when the time you heard this story, the use of AI in healthcare maybe was limited. Now this is the time when AI and other technologies help healthcare sector to go down to the diagnostic level, to look at why is this there? So when we've collected the data over the years, when we've looked at and studied at it, we're now at a position where not only the technology, the regulators, the medicine practitioners, and different stakeholders are ready to use it. So we're now at a step where the medicine is not looking at just at preventive, but we're actually going down the curative way. That's why you have even alternate medicines doing extremely well at this point.
No, but the point is, why curative? Why not preventive? Why don't you just close the tap? In other words, I chased the Pepsi guy yesterday because they're killing kids through obesity, through sugar, diabetes, and so on. This is the third highest incidence of diabetes in this country, right? 2/3 of the people are type 2 diabetes right now. Okay? So why don't we just switch off sugar? Why don't we just switch off sugar rather than fix things?
Because sugar is not the enemy here. It's how you've consumed the sugar is what we are tackling.
Ban it.
So yes.
No.
So we're talking about now educating every consumer. These colas, when they came out, if you're taking example of Pepsi, when they came out, there was a specific requirement. Maybe the taste buds we're talking about, or the commercialization is what we're talking about. So if we say that we're now going to close sugar or close down these cola companies, it's not what we're looking at. There are businesses to be running everywhere. We're talking about how do you manage it.
All right.
And the technology helps you with that.
Jonathan, you're a physician. You cut people up, right?
So there's
So don't cut people up, fix them before they get cut up. So you're out of a job.
I think it's a great point. I would love to never do surgery again for that reason.
Okay.
Part of the reason I went into surgery is because I could physically see the problem.
Right.
I always felt there was some sort of unfair bias that I was somehow promoting sick care instead of health care.
Absolutely. I was going to use that phrase later on, actually.
And to your point, behavior change is very hard. It's I think the very most difficult aspect of being human is that we have these hardwired, ingrained behaviors that start at such a young age. And so it's only really through the powers of education that we can change those things.
Yeah.
But to bring it back to AI, where can AI implement behavior change? And that's the kind of artificial intelligence I think is most important, is how do we track the behaviors that we have to identify the ones that could lead to problems? Yeah. You know, it's very, I mean, I'm sure people here in the audience have started a new behavior in the past 30 days that they're trying to keep up, whether it's exercise, whether it's diet. But fundamentally, everything you're talking about is preventative medicine, which is we need to be able to detect people who are higher at risk before those problems begin.
Thank you. You know, President Kennedy, at Rice University in 1961, when he spoke about going to the moon, he said, you know why we're going to the moon? Not because it's easy, but because it's hard. So hard is not a block. That is just something that we have to live with and find a way through it. This country is doing this regularly, so I don't see that as a positioning at all. Just because it's hard, so what? So I'm being provocative, as you can see. Let's just get this thing out, and then we'll get the audience involved. Dr. Bassam, why shouldn't we go into preventive? Do you work in a hospital?
Yes.
Okay, so when I come to a hospital and I'm sick, what happens? You put me into a lot of tests, to test 1, test 2, test 3, test 4. Everybody, ka-ching, 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 ka-ching. Then, you take me to 3, 4, 5 places. Your interest, say you're in a private hospital. If I go to Mediclinic, I took my mother there. The interest is to put as much money as you can before you even engage with the patient. That's how you make money, or not you, the doctors and the hospitals make money. What is their interest to shoot themselves in the foot by being preventive or by doing other things or going into AI and making life simpler so they make less money. How do they do that?
So, how many of you here are practicing physician?
Two,
Seeing patient recently?
You're all
I
patients.
know all of us, I know all of us are patients, okay? But they're not patients. So, the point is, it's very easy to come in an event like this and to talk about AI, and to talk about using technology, and talking about preventive. In fact, it's very sexy whenever you say AI. Everybody will think that you're smart and you're talking about. But the truth of the matter is, there is a lot of cultural legacy, not just here, but all over the world, is going to, when we go to the doctor is when we have the problem. I'm a respiratory physician. I see patients with asthmatics. They come to me these days because of the sandstorm, because of the winds and everything. Once it's gone, they stop taking medication. And I'm not just talking about somebody who's not educated. I'm talking about the average Joe, even the educated ones, okay? I've got a patient yesterday who is a PhD in pharmacy. She was telling me everything that has to do with asthma, but she doesn't want to admit that she has asthma, and she smokes, and she does all the other things that makes asthma. So, first of all, yes, I think not as a health planner, but even as a population, we should think of how to prevent things. So, believe it or not, I'm a pre-diabetic because I have a family history. I became only conscious about it when I put this patch and I started watching how much of sugar, which food makes my sugar high. So I do this maybe because I'm a geek, because I'm interested in technology, although I'm being a physician, but you need to do this. So that's number one. So it's a cultural thing to start thinking that if you don't see this, but people, they don't want to listen to this unless they will see results. So when I get a smoker person with a COPD, which is emphysema, I don't speak to him, I speak to his son. And I tell him, this is what will happen if you keep doing this. So this is culture, and this is all over the world. Now, what technology can help us with this is to show people through predictive analytics and using machine learning what would happen to them in a machine algorithm, that if you keep doing this 1, 2, 3, 4, 5, this is what will happen to you. 3 days ago, my sugar was 120. I went on a treadmill for 20 minutes only. It went down to 80. It's a very strong message. More than a doctor would say that to me, more than anyone. So it's culture. And I think technologies with millennials can work very well to make this message clear.
Great, thank you, Dr. Bassam. AI as a technological tool can enable us to accelerate the process of registration, or when you actually go into ER or into hospital. Dr. Bassam, how long does it normally take if I walk into a Ministry of Health hospital for me to be, other than if I am in chronic ER, how long will it take me to go through that process of registering my name, ID card, passport, credit card, insurance, blah, 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 and then all my historical tests? How long does it take? And what needs to be done to address it using technology?
So I think the key word here that we are talking about is connected care. So all these kind of documentation, or the end is to how to can identify my patient across the care continuum.
Yes.
So this is one of the messages that even now we are trying to convey to the community by putting into by putting forward applications like the Health Information Exchange. So Health Information Exchange is a technology solution that allow us to follow patients wherever they go, So if you go to a new doctor for a certain reason, he will be able to fetch your history and then deal with it and give more informed decisions about it.
Sure. So why don't we have
centralized?
centralized data records? Why don't we just walk in one place, one tap, and they know exactly everything about me? Why don't we have that? And why is it taking so long to be what regulatory issues are there?
It's very challenging, bringing all those silos together. That means that they have all to speak the same language. Here we are talking about interoperability that allows all solutions to talk to each other. This is not easy. This is a change management. This needs the support from the top, from the government. The support, we need to influence vendors, which is a not easy job. Making sure that Epic and Cerner and InterSystem talks to each other. This is not an easy task at all.
I think what I would like to add here, what Dr. Assam and I were talking earlier, that in February we have the Federal Law Number 2, 2019 that has come out, which actually supports a centralized suppository, a full data system for centralizing all the health records in the country.
Right.
And also health information exchanges are getting a lot of support from the government, one of them being the Injazat program, the Hadib program that is already on in this. But one of the key elements that you have to see right from getting different stakeholders and these technologies to work is also the sensitive issue of health data.
Yes, absolutely.
Which is extremely sensitive personal information, not only of the patient, but as for the country itself.
Yes.
So that has taken a long time, but there's been a lot of work in that space, especially in the last 2 years in the country.
How far are we? 1 year? 5 years? 10 years?
The law is out. The technology is ready. Three months from the time it gets published in the Gadget, it will be out there.
Okay.
Yes.
I took my mom to a hospital. She was in a chronic situation around 3-4 months ago. I took her to a private clinic, Mediclinic hospital here, and she was in a lot of trauma, but by the time, and she's 83 years old, so insurance for an 83-year-old doesn't exist. That's another conversation. Old people, no insurance, throw them out. They're ready to die or you pay. So by the time she went through that process and the waiting process, it was about 2.5 hours before the first doctor saw her because it needed a second doctor's opinion, it needed her cardiologist, it was late at night, so they had to be called at home. Without that, they wouldn't move, the liability issues are there, the insurance company, and. What I'm trying to get to is that it's so frustrating within the healthcare sector that with so much technology, you guys are so smart, why don't we overcome this kind of thing? Jonathan, you're on the front line. What do you see? How do you engage with something like that when you want to? I'm sure patients give you that feedback.
Yeah, it's, the time component is significant, especially when you have a busy practice. Part of it is because we live in a medical legal society where we have to protect ourselves and our patients. So documentation is an integral part of every step of the medical process. When you check in, documenting every part of the patient's journey. So unfortunately, that's time consuming. And the amount of paperwork that most physicians have to do is extraordinary. Nobody thinks that when they go into medical school that they're going to be 50% of the time doing paperwork. But this goes back to what you were first saying, which is how do we spend our time better as physicians helping people do things that are preventative? So if I could spend less time charting, if I didn't have 30 notes to write at the end of each clinic, that's more time I can spend with each patient.
Yeah.
And that's more quality time.
Absolutely.
I can actually have a discussion about stopping smoking. I can have a discussion about diet. I don't have time for those things when I know that I need to see that patient, provide them a treatment plan, and also write a note. So there's pockets where AI can help that doesn't actually involve medicine at all. Speech recognition technologies and note-taking, organizing patient scheduling. There's logistical operations where AI is potentially useful that never even have to involve a patient.
Sure. Let me look at diagnostics now, which is an integral part of the medical space. IBM Watson and various other technology tools that are now available, they enable us to do a lot of good diagnostics. So today the doctor is here and the average nurse is here in terms of importance, learning and so on. Over the next 5 to 10 years, it's going to actually start changing. Because the doctor or the caregiver will become the key person, because 80% of the diagnostics will be done far better from a machine. So an AI machine in our back pocket or a computer with us is going to be our asset, and you as a doctor will then start becoming more empathetic, more connected, more giving care, spending time being a doctor, not a diagnostician, because all of that goes away. This is, to me, the fundamental shift, that doctors will become caregivers again, as opposed to paper pushers, as opposed to diagnosticians. Any thoughts? Dr. Bassam?
So, I would refrain from saying these kind of provocative words to the medical society.
Okay.
Okay, so it might be fine for you to say it here, but
I'm not a doctor, so I'm not.
I know.
I'm not applying to the society, so I can get away with it.
no. But the thing is, we would like to call it an augmented intelligence.
Yes.
We would like to say that the caregiver, be it a physician or nurses, they are more at taking a better decision by using these technology.
Correct.
For two reasons. Number one, efficiency with time. We all used to be complaining and bitching around, why do we have to type instead of writing in the files, but now this is working and it's much better and more efficient. So time-wise will be more efficient. But again, dealing with the big data, a human mind will not be able to know, A, everything about the patient, B, everything about that disease, particularly when it comes to the genomics and all these things. So you need a computer with that.
Sure.
So, yes, but as my colleague said, there is a lot of medico-legal things. I mean, part of the challenges we are having now in regulating telemedicine is not about technology at all.
Sure.
It's about the legal part of it.
Well, yeah, so that 100% agree. I was reading in the medical journal. I do read geeky stuff. I may not look like a geek, but I do geeky things. Reading the medical journal, and it was a very interesting study in there, where they said that in the year 1950 or 1960, that at that point in time, medical knowledge was doubling every 73 years. Now it doubles every 50 days, knowledge. So the human brain cannot absorb all that knowledge anymore. So the average doctor cannot stay up to date anymore. So the data is actually going into the AI systems and so on. That is where it's being captured, because it's doubling in 50 days rather than 50 years. That is the speed at which change is happening. And that is why I'm saying that you doctors will become more caregivers, wisdom, connection with the patient, caregiving, as opposed to the data. And I think data science and AI, that's when it starts coming in. So perhaps you can explain to the audience what kind of new technologies are coming in so to augment the doctor's work. Jonathan, you there? And perhaps...
I would start by saying, unlike most other industries, technology really hasn't happened to healthcare yet. And I know that might sound shocking, but the way Uber has happened to the taxi industry, Airbnb to the hotel industry, that just hasn't happened in medicine yet. If you took a doctor from the 80s or 90s and put them in a hospital today, they'd more or less be able to figure things out and get the systems running. Like the fundamental structure of the way healthcare is administered hasn't changed. That being said, people do acknowledge, physicians do acknowledge that there's just no way to possibly comprehend all of the data that's out there. And that's not a new thing. It was in the 60s that a physician by the name of Larry Weed gave a grand rounds at Harvard, and he said, it's inconceivable that the human mind can comprehend all of the medical data in a patient's chart. And then he gave rise to what we now know today as a patient file. Until that point, a patient's record was just completely all over the place. So keeping that in mind, any kind of technology that changes the way systems operate will fundamentally change the way healthcare is administered. But alleviating a physician's administrative burden is significant, but also seeing things a doctor could never see. A doctor, the most trained radiologist out there, can't look at a scan and predict the genetics of a tumor.
But the radiologists are now one of the threatened areas with robotics and AI as it comes in because of the efficiency of it. Yeah.
So any pattern recognition specialty is at risk. That's dermatology, pathology, radiology, where the very basis of that specialty involves looking at an image and making a judgment.
Right.
But it's not that they're going to be out of a job, it's just that their job descriptions will change.
Indeed, indeed.
There's not going to be fewer dermatologists, they're just going to be doing different things. They won't be looking at scans, but there's going to be so many more images for them to look at. Imagine now instead of a patient going to a dermatologist to get their images done, they take it with their phone. We all have a phone, we all have a mole that we're concerned about. We're now suddenly creating 10 times the amount of data that we'd ever have to look through. So technology, AI could be used to stratify high-risk cases so physicians can then look at them and maybe alleviate the administrative burden.
I'm going to come back to... Got it. I'm going to come back to democratization of health, in other words, how to make it free, globally, everywhere. So that's another question, but you said you may have a question, you can speak into this. Let's just ask a few questions.
Thank you for... Not working? Yeah, we are there. So my name is Paul Epping. I'm quite long in the healthcare business and technology. And guys, you are thinking so old-fashioned. Sorry. I mean, talking about an EMR as your core of your healthcare system is not going to make it. There is a lot of development out there talking about your personal health record, which is, in the end, the ground truth, right? And you are the owner. That's one point. The other point, here everybody in this room, I advise you to read immediately Eric Topol's new book, Deep Medicine. Maybe that opens your eyes. It goes faster than we think, right? And the most important thing here is that I don't see a future for healthcare. The healthcare that we are doing it the way we do it now. We are talking about healthcare, but we do everything except healthcare, right? So we're talking about precision medicine, whereas I think, well, don't talk about precision medicine, talk about precision health. Turn the things around. If I hear you saying just now, 2 minutes ago, yes, that profession is at risk. No, they are not at risk. They just going to disappear and figure out what you can do. If you still want to work in healthcare, then do it differently. What I mean by differently is what Tarek just said. I think that the nurses will take over healthcare and no doctors, because it is repetitive work. The thing that I really scary about and fear is I'm in many hospitals around the world. People are not ready for this shift. And people are not ready for the shift because leadership is not ready for the shift. And leadership doesn't see coming and doesn't take actions. That is a problem. Really problem. We do the things that we did yesterday, but not what we have to do tomorrow.
Thank you very much for that passionate statement. Defend your industry, guys. You've been trashed. Go for it. Jonathan.
Can I just add from my legal industry?
Yeah, are you going to defend yourself or trash?
Of course,
okay,
I'm a lawyer. So when smart contracts came into being, every lawyer who's in the tech space started talking about, we'll not need lawyers anymore. We have smart contracts. Well, till the time we have humans, till we have the jurisprudence, till the time we have society, lawyers will always be needed. So yes, we're talking about healthcare and saying that we don't need them, because we're now going to focus not, say, so from the preventive to actually taking care of health. You'll not need what is the current system is just a little over the top, because
Okay.
What the technology does is enables them to grow a step further. That doesn't mean that I need to let go of this segment.
Understand that. And I don't think that it is a mutually exclusive conversation. I don't think that doctors are out of the game. It's just that their role changes.
Yeah.
As I said, in terms of caregivers, because the diagnostics will be very, very easily available. But I personally think there is another sort of grenade that I can throw in. The hospitals want to make money. The pharmaceuticals want to give you lots and lots and lots of medicines, and the food industry wants to make you sick. That's the trifecta that's working. And that is what needs to be addressed, all three of them, because you're dependent on the insurance industry, which is dependent on the food industry, which is dependent on the medical industry. To me, I think vested interest is an extremely relevant factor to consider when you sort of say, we need to change. Food, healthcare, and energy are the three industries that are resisting disruption and change the most. They have the biggest budgets, they have the biggest lobbies, and they don't want to change. They always come up with an answer. So really the question is, the change will come and hit them anyway. Question, Dr. Bassam and the three medical professionals that are there is, how do we completely revolutionize using technology, using AI and so on, and have a completely different perspective, wear a different lens in front of our eyes to be able to look at healthcare. Short term, you're okay, but medium to long term, say 5 to 15-year period. Anybody? A couple of remarks and then we close.
So, the simple, well, not the simple, I mean, it's a very complicated answer, but whenever you see big lobbies of professionals, like in the States, the more likely you will get resistance for them to change. And it's a well-known fact. But I think technology is coming, whether we like it or not. It's coming in our life, so it will come into the way that we live our life, so it will be also affecting the way that we practice medicine. I think we need to have another breeds of physician who understand technology very well.
Correct.
And who can leverage it to the best way that they can deliver care. The problem with the healthcare, it has its own legacy. And part of this legacy is, part of it is lobbying, but also part of it is the medico-legal part of it. So if the AI gives me a wrong diagnosis, if it gives me a wrong algorithms of something, that what happened with Watson when they took it to India. So this is where we have a lot of problems with it. And if you read Lancet and if you read the New England Journal of Medicine, which are the leading journals for us, they're talking about points like this. So I would just leave it vague at this stage.
All right, sounds good. So we'll close with a final comment, a 30-second hit. What keeps you up at night? What scares the hell out of you? Each one of you.
So now working in this space, with seeing the way technology is developing, not just in the healthcare, but overall all sectors, and seeing where the regulations are, that scares me. Because the history has shown that regulations and technology has always been at a gap of at least 100 years. Now we're down to 50 to 40 years, but there's still a huge gap between the development, that's the pace at which the technology develops and the pace at which the regulators, we do understand the limitations, but yes, that's scary.
Okay, thank you. Great answer. Yes, sir.
Okay, so simple. So
Close.
I'm looking forward to develop, a legal regulatory framework that encourage innovation from AI, blockchain, or whatever, to help our healthcare system to move from fee for service to value-based.
Yeah.
When I move a patient who's, I won't say a patient, a pre-diabetic, from the risk zone to the safe zone, this actually saves the government, the healthcare system, a lot of money. I want to quantify this money and give it as an incentive to all parties who will participate in this process.
Sure.
Yeah,
Thank
this
you.
is the only way.
Thank you very much. Jonathan.
There's three things that keep me up
apart
at night.
from your knife and your sharpening your knife.
There's three things. The first is everybody I speak to thinks they're right. And I think everybody's entitled to their opinion, but managing a conversation and understanding everybody's needs is challenging. The second is, as soon as you solve one bottleneck of a problem, another one shows up. and I can never predict what the next one will be, and that's challenging. And the third is, AI will disrupt healthcare in good ways, but it's the bad ways that I'm concerned about. What kind of system failures will happen when we have people that are less knowledgeable, when people with less training and expertise are relying on diagnostics done by machines?
Sounds good. Thank you. Thank you very much indeed, Jonathan. Final comment?
Two things that keeps me awake. My 4-year-old son, who doesn't sleep easily. And the second one is, I'm afraid that we're losing the human touch after the medical professional. That patient will still need it despite all technology.
Great. Thank you very much. Wonderful answer. Big hand for our panel. Thank you very much. I know I was challenging them a lot, so thank you for being sporting and being responsive. It's done in a context of a positive spirit, because that's how we learn and develop. Thank you. Thank you, gentlemen. Sir,
Thanks.
Thank you.